Tuberculosis is an airborne disease that is spread from person to person when an individual with untreated pulmonary tuberculosis comes into close contact with another. The uninfected person may get the disease if they inhale the same air in which the infected person has coughed, talked, sneezed, or sang, and therefore inhale the Mycobacterium tuberculosis bacteria.
Mycobacterium tuberculosis is the bacteria that causes tuberculosis. It is estimated that 1/3 of the world has Mycobacterium tuberculosis in their lungs, but that doesn't mean that they are all sick. It could be active or non-active. Tuberculosis is transmitted in what is called droplet aerosis, which just means that it is spread in small mucus droplets, usually through the air when someone speaks, coughs, or sneezes. Inside the tiny air sacs in the lungs, there are things called alveolar macrophages, which are there to keep you from getting sick by ingesting bacteria or other debris that gets into the lungs. The macrophages in the lungs engulf the bacteria, but they typically cannot destroy it due to the waxy coat. The bacteria can then destroy the white blood cells that make up a person's immune system and make that person sick. The bacteria may grow slowly because the person's immune system is fighting it, or if the person has a strong immune system, the bacteria may go dormant or inactive and stay in the lungs for decades or for life. Sometimes the bacteria can get into the blood. This happens when a person is immunosuppressed. For example, the patient has AIDS, cancer, or is malnourished. The tuberculosis can then spread into the blood or other organs, usually the kidneys or the bones.
Manifestations of tuberculosis can vary due to age, immune status, and coexisting diseases. The most common is a persistent cough lasting 3 weeks or longer. The cough may seem unproductive at first, but as inflammation and tissue death occur, it will start to produce mucus. Other manifestations are fever, night sweats, chills, fatigue, coughing up blood, loss of appetite, and unexplained weight loss.
The overall goals for treatment of tuberculosis are to cure the individual patient and to minimize the transmission of Mycobacterium tuberculosis to other individuals. Most individuals who have drug-susceptible tuberculosis are able to be cured with 4 major drugs used as first-line treatment. This treatment takes a minimum of 6 months and may need to be extended up to 1 year. All 4 of the antibiotic drugs mentioned are to be taken for the first 2 months, and isoniazid and rifampin are to be continued until all tuberculosis germs are killed. However, as we learned earlier, individuals with latent tuberculosis infection do not have symptoms and are unable to spread tuberculosis bacteria to others. For these cases, isoniazid and rifampin are usually the preferred drugs to be administered in combination for 3 months. The dosage of these drugs are very similar per patient, but may differ due to the weight of the person. Of course, it is important to assure you follow the directions your doctor recommends to you. If you stop taking the drugs too soon, you can become sick again or antibiotic resistant.
If the body does become resistant to the antibiotics used to treat the disease, the drug is no longer killing the bacteria and the tuberculosis is known as drug resistant. This usually happens with the drugs isoniazid and rifampin. When this happens, second-line drugs are used as well as injections and taken for up to 2 years. Compared to the first-line drugs, this treatment is more costly and has stronger medications. Taking care of this type of tuberculosis is extremely important as it can have severe symptoms and life-threatening results if done improperly. Becoming sick again is also possible. The treatment must be started again, or a different treatment program may be needed in this case altogether. If the patient stops taking their treatment because of the long commitment to the course of the drugs, directly observed treatment is available as well. This form of treatment involves the trained healthcare worker providing the prescribed drugs and ensuring the patient takes the dose. It is very important individuals with tuberculosis completely finish their treatment in order to treat the disease.